Hello, my name is Michelle Coble. I work as a diabetes educator with the Lincoln Trail District Health Department as part of the Kentucky Diabetes Prevention and Control Program. Today we're going to walk through how to use your curriculum disc to teach diabetes self-management education. As you open your disc, you will see there's lots of different folders on it. One of them being the comprehensive curriculum, which is where you'll go if you want to teach classes. The other things on there would be the diabetes basics, which has slides for how to use the basics booklet, as well as a Adobe copy of the basics. Nutrition basics has the same information, only about the nutrition basics. The prevention curriculum, if you're doing a class just on diabetes prevention, and then sample evaluation forms and resources that you may use. At the bottom you will notice there's also some smoking materials, which would be handouts for people who want to quit smoking that may be part of your classes. As you open the actual curriculum disc part, you will see that it has agendas. The agendas is simply a sample of what an agenda would look like in other classes. This is totally for you to make your own. You can change it around and teach whatever parts you want to. Some people break it up into 3 classes, some people break it up into 4. And then it has a policy. Every year we ask that you sign a policy stating that you will send back information regarding your classes and your participation and evaluations. Each list then from there is the AADE7, which is being active, which we'll talk about exercise and being active with diabetes, healthy coping and how to reduce stress, healthy eating, the nutritious part of diabetes and how to keep your meal plan what it should be and how eating healthy plays a part with your blood sugars, monitoring your blood sugars as well as the tests and exams you need to have done, problem solving for high and low blood sugars, for sick days, for traveling, for things that come up on a day-to-day basis for somebody with diabetes, reducing risks, and we'll go over that just a little bit more in a few minutes, but reducing risk is all the complications when we talk about long-term complications and how to reduce the risk of achieving those. Taking medications talks about the medicines associated with diabetes, and when we get to that, you'll see there is lots of information in there to help with teaching medication. When we look at the reducing risk, as you can see, there's lots of different small pieces that go with that. So if you had a call for somebody that wanted an eye disease class, you could go and just use the PowerPoint for eye problems or eye disease and talk about how to prevent those risks from happening. And then if you see at the top circled, it says looped reducing risk of complications. That has all of the complications already set up in a slideshow for you. So if you were teaching the class, you could go through all of the reducing risk categories without having to open separate files. As you look at medications, you'll see that it has both the PowerPoint as well as with all the other ones. It has a section that is a read-only section of how to teach each part. And then it also has a section for medication handouts. With our curriculum, we developed some handouts because medications are very hard to remember, very hard to say, oh, what did she say 20 minutes after I leave the class? So we developed handouts for each of the different classes of medications that you can give to your patients so that they will know and have something to refer back to learn about their specific medicines. That's pretty much it for how to use the curriculum. Thank you and good luck with doing this.
To be able to collect information and enter it. Has anybody gotten to see that, or just a couple? Okay. That's what we're going to just take the next 5 minutes or so and just look at. And if you can't remember the website, if you just Google Kentucky Diabetes Resource, it'll come up. And then you can click on it if you can't remember the web address, because it's not a totally easy thing to remember. But the purpose of doing that Kentucky Diabetes Resource Directory, it is web-based so that the public can get to that site, so that it can help you connect people where they can make connections out in their communities with at least what's listed on the resource directory now. And that resource directory was built where we can add to it, so we can add other categories to it. And we knew for years that we had diabetes education happening out there, and endocrinologists and support groups, but we didn't have any kind of way to put it all together where we really knew what was a total numbers of type things out across Kentucky. So that's when this resource directory was really built in November of 2010, and with the help of the office here in Frankfort of Administrative and Technology Services. And so when it was originally built, we just collected information from hospitals, health department, diabetes educator chapters, endocrinologists, coalition support groups, and that kind of thing, to come up with listings, that are right now listed in there. So what we have available that people can search for across the state are diabetes self-management education, group classes or one-on-one, diabetes support groups, diabetes coalitions, endocrinologists or diabetologists, and medical nutrition therapy. And then we just recently added the CDC recognized diabetes prevention programs are also now listed on that web-based directory. It is a work in progress, and you know, any kind of directory like that, as soon as you get it built, it's already out of date. So that is one reason why it's actually become part of all local health departments across Kentucky. All of you all are going to be helping really to try to keep this website up to date, not just for your health department and what you may be doing, but what is going on if you serve that county, what's going on related to the categories that are in there right now, what's going on, or if you cover the district. The health departments are going to be sort of taking the lead in trying to help keep this as up to date as possible. And so we're really excited to have everybody's help in doing that. That is the web address. It does have Kentucky Diabetes Resources at the end of it. We have cards made up that you can get copies of, or print copies to share and give out to your community. As far as searching on the resource directory, there are a couple ways you can search. You can search over in the left-hand box, or you can just click the big click here on the main page, and that's going to bring up all of your categories that are available for you to search by. You can see from the categories, you can search all resources. If you wanted to click all and you wanted all counties across the entire state, you could leave it all and click search, and it's going to bring up everything in all categories that's available and been put in that resource directory. There is a description of what those resources are on the left-hand side. If you click on descriptions, it'll give you the description of how those are defined, as far as how do we define a diabetes class, or the CDC recognition program. For example, the CD that Michelle just talked about, that has your diabetes prevention community talk that you might want to go out and do, is not the same thing as what's listed here. This is an actual year-long program that you have to go through CDC recognition for. It's called the Diabetes Prevention Program. And so if you're doing the kind of programming out in the community, just making people aware of pre-diabetes and diabetes prevention, that's not the same thing. We don't want that listed in here. Only CDC recognized programs that are doing the year-long programming. But anyway, just to point out that this sort of gives you the definitions of what's listed in there by those categories, if you would want to see that. And then your search page, like I said, you can search for one. If you wanted to search for diabetes classes in Henderson County, you would just click on diabetes class and then go down to select the county and click Henderson. But if you also wanted to see, well, let me also see if there's anything surrounding, you know, in a close proximity, then you could also click on search adjacent counties. And the way this resource directory is built, it'll pull the listings for that county and any other county that touches that county, physically touches it. That's how it was actually put together. So you can search sort of by region, by single county, or you can search all. I'm ahead of myself. That's what that slide just said. Okay, so this just shows you an example. Like if you were to search for diabetes classes, just to give you an example, the resource comes up. Like if you were to print this, it has what it is that you searched. Diabetes classes over here, because that's the category. And then it'll have the county listed in alphabetical order for all of those categories if you searched all of them. And then it's going to have your meeting site or name location, your meeting information, what time they meet, and that sort of thing. So try to be as thorough as you can be when you're entering this information, and collect as much information. Like you might be collecting information from your hospital, support group, your doctor's office, whoever might be out in your community doing diabetes services. So try to get as much information as you can to get it in here, because remember that it's the public. You're trying to make the public and have them be able to connect with these resources out there. There is a Learn More category. There's a spot that you can put in special notes if it doesn't fit anything that is in the data collection tool. And so anything that might be special notes, you would have to go to that Learn More to be able to see any special instructions there. Okay, we talked about it listed in alphabetical order. This just shows you examples of the diabetes prevention programs, and this actually just recently got added. Remember I said at the very beginning that this was built so that we could add other categories over time. So this is a category that just recently was put in there, and we still have to go in. The database had to be built where we could get these other details in there, and that was just recently completed. So there'll be we'll be adding more details about the diabetes prevention programs shortly. In fact, it's happening as we sit here. Okay, diabetes support groups. Again, it tells you what you searched, counties in alphabetical order, all the sites, and gives you more information about it. So they all come up basically the same. That's your diabetes endocrinologist or specialist, your diabetes coalitions, medical nutrition therapy, search example. And then one of the things that the resource directory was also built for was to allow people to be able to make changes or updates to the resource directory. So the public and or you all and or your hospitals, you can teach other people how to use the directory. But if a resource needs to be added or updated, you can click on that and you're able to do that, either adding a brand new resource or updating what's already on there. And that does go to someone to check it before it's allowed on the website. And that's just sort of a safety precaution so that somebody can't get on there and mess the whole thing up. It'll go to somebody to actually approve that before it gets posted. So a lot of times there's days between when you might make an entry or a change before you actually see it if you were to search and look for it in the resource directory, and that's because it's going through an approval process. Okay, there's also a feature that you can print your resources that you're searching for, or you can save it and send it to people. Like if they're looking for diabetes classes in this region, you could actually pull that up and save it as a document and then email it to somebody. Or if you wanted to do that, or print it and mail it to somebody. So by clicking on the printable results, it's going to allow you to do that also. And that shows you what, like it's in a more user-friendly format, I guess, than when you're just searching for it live. Okay, there's also links on this Kentucky Diabetes Resource Directory, Kentucky Diabetes links, and then there's also links to some national ADA, JDRF, KDN, KDPCP, NDEP, and NIDDK alphabets, all of those national diabetes organizations, and it gives you a description of what they are. And it also allows for you to, there is a way that you can even post events that you want to automatically be deleted out of there once that event happens, and there is a date. I'd have to get on it to actually be able to show it to you, but there is a date feature as part of that resource directory that if you enter something in there, if you, like October 1st, on October 2nd, that entry is going to be out of there because it's got expiration date on the data entry screen. So there is a way to do that also. We can also see how many times, and this is old, that the resource directory has been accessed, and that's on the administrative side. And like I said, it is built where we can add more additions and more categories in the future. And that shows you the card that has the web address that, did we have those here? They've got
They're in their binders.
Okay. So, and we can actually send you that, where if you want to print your own cards, postcards, etc., that you can do that. Are they available in the pamphlet library? Did we
know we have them here. I don't know if they're available in the pamphlet library or not. Do you know, Rita?
I don't know.
I'm thinking they may be here.
Okay, so
you can always let us know. We'll send them.
So you can let us know, Teresa's saying. Are there any questions about the resource directory, or? Okay. And I'm not sure. Let's see who's up next.
Rita.
It says that they're in the pamphlet library.
Oh, good.
It does say that in the list that we have in our.
Yeah, you were saying earlier how to access the listing from the pamphlet library.
If you will call the business number, it's in your folder or your 3-ring binders under the resources. If you'll call that number and give them your email, they will email you a spreadsheet of every pamphlet that they have and the counts that were last updated. And it won't just be for diabetes though, it'll be for everything.
Carmen has done that and put it on our drive, so she got an updated listing sent to her and put it on our drive. So.
And they will do that, but you said it was like through the help desk?
I don't know if this was a number that I called particularly or not, but whatever number I was put in contact with, they answered and said this is the help desk for this pamphlet library in Frankfurt Rehabilitation or whatever. So you may be talking to somebody at a help desk, but they took my email and immediately sent me an Excel spreadsheet of whatever was available at that time.
Right. What we actually received only had the diabetes, so
yeah, this is everything, like WIC stuff and smoking, and it had everything.
Okay.
Good afternoon. I just want to say that it is a pleasure to be able to actually see your faces and to see you in person, because our program, we do a lot of communication by email, by conference calls, by distance learning and that kind of stuff, and it's really nice to not have to travel the distance and a lot of times, but it's also nice to actually see people's faces. My name is Rita Jones, and I am part of the staff here in Frankfurt with the Diabetes Prevention and Control Program. And I'm going to be talking just a little bit about, I think, the fourth resource for diabetes self-management education that was listed on your agenda today, and that is the National Diabetes Education Program. How many of you are familiar with that program? A few of you. It's been around a long time. When I was looking to think about that, it's 1997. It's been quite a long time. And it is a national partnership started at the national level, particularly between the Centers for Disease Control and the National Institute for Health. And then they work with partners at the national level, key diabetes-related partners, and like lots and lots of partners. And the purpose of it, of course, is to reduce the impact of diabetes and prediabetes and to facilitate implementation and adoption of evidence-based practices out in our all across the country to improve outcomes for diabetes and to reduce the incidence of diabetes. But it was one of the things early on in that program had to do with some information that they had seen that people didn't even think, that the general public, I remember they said that only 6 or 7% of the general public think diabetes is serious. A lot of people, they tend to think that type 1 diabetes is really serious, but type 2, you know, it's just a little bit of sugar. And so back in those days, that was one of their first big efforts, was trying to increase awareness related to the seriousness of diabetes and, of course, a lot of other diabetes-related information. And some of the latest information, that has risen really a lot in the last 10 to 15 years. That I can't quote exactly what that is right now. But anyway, it's been around for quite a while. How many of you have actually been on the website to see those materials? A few of you. Great. Well, I don't want to bore you with this, but I'm going to actually show you the website and just point out a couple of things. There are many resources in there that go much beyond diabetes self-management education. But I'll point out a couple of things that might be useful for education and just kind of mention a few things that are of interest on there. But it is always changing. It's a monster for them to keep up to date. So sometimes you'll come across a site, you know, like you'll try to go to a site and it'll be not up to date. It'll be no longer linked to the correct place. So just be patient, and they usually get to it and get it more up to date again soon down the road. If you want to go to the site, you can just Google NDEP, and usually it's about the second thing on the list to be able to pull it up. Or take a look at your handouts under the tab for resources, the last couple of items in there that are in sleeve protectors. The address is on the bottom of the second sleeve protector. You can look at that, ndp.nih.gov, to pull that up. But anyway, Becky pulled it up here for me, and as I said, there's a lot of information on here. The place that you may want to look at in relationship to program or materials that you might want to give your patients in this kind of a class that we've been talking about today is under publications up on the menu bar. And if you click on that, there are lots of different publications, and I have made a printout for you that lists what those, so you can just kind of see those and see a little summary of what's on there that's in that second sleeve protector. But there, you can extend it so you can view them all here, and you can sort them in a variety of ways, which they're sorted right now according to the most recently updated. And they are working, some of these materials, they're working, in fact, going through all of them, not only updating them, but making them more simpler literacy. I think they call it plain English, plain language principles, I guess. They're updating them for that. So the very first one that you see on this list up here, it's rather small from where you are though, is the example I put in that first sleeve that is Know Your Blood Sugar Numbers. And this one talks about the A1C and self blood sugar testing. And it's just an example for you to see. Most of the, or all of the resources now on NDEP are PDF versions that you can print out, and they're copyright free, so you can use, adapt them, do whatever you want to with them, copy them and that kind of thing. But they used to send you complimentary copies or a small amount of them, and you could order them. It seems to me, they haven't conclusively told us that, but from what I can tell from the website, and I even emailed them and they never did verify that, but it seems to me that you don't get an opportunity to order them order them from the site anymore. However, our state program does sometimes order some, or pick out key things and make copies available at the pamphlet library, and there are several of them there now. And if you find something that is very useful to you, let us know and we'll consider printing it if we're able to. I know Joan just told us the other day about a piece that she wanted that had to do with diabetes prevention. And I think we are making arrangements to go ahead and print that very soon to be able to do that, so let us know. And just notice that you can sort these by most recently updated. You can sort by the number of the item on the back of the sheet. And like, for example, this one is NDEP 10. And so you can sort so you can line them all up in that way. But there's a ton of things on this website, so it takes a while to look through things. And I just want to show you enough so you might be hungry to go back and take a look at it again.
Rita,
Yes.
about a month ago or 2 months ago, I was able to get on there and order some diabetes prevention materials. I tried to go in there last week and order those same materials, and I could never get to a point where I could order them.
Yeah,
so I don't know, just in that length of time, if they've stopped where you can order them. But I could order them in like 10 at a time, and so I ordered some, and I thought I'll wait a while and I'll go and get some more because we're going to do a program. Couldn't do it. I thought, I know I just did this.
Well, that's what
I could not figure out how to do it.
That's what I found out when I was looking at it last week, and
Well,
I couldn't find a listing.
I thought, how did I do that?
So I emailed the director of it from CDC, and I said, I can't find the listing of the publications and the da-da-da-da. And she said, oh, that's a problem. She didn't. But later I sent back to her and I said, I think I figured out why it's not.
I found it,
anyway,
but I couldn't order them. I could get the listing, but I could not order anything.
Okay. Well, anyway, so that's one place you may want to look. The next place is, let me go back here, is the resources. Now that doesn't have as many things related to DSME, but it does have a lot of things that are useful for doing awareness programs that you may be doing also in your communities. And you have a list of those various resources. One thing I want to point out under the resources, and you can see over here to the left on the screen, it has videos. If you click on videos, it will take you to the videos that are listed in this listing of resources. And I also give you a table in your handouts that has a listing of those videos. And these are ones that you might be able to use just for some variety in your self-management classes. For example, like setting goals to improve your health. That's about halfway down the page. Most of these videos are about 3 to 4 minutes long, 2 to 4 minutes long. So if you get a chance, it would be great to go in and look at those things. I think my time is about up for this particular. I was going to show you several other things, but I just wanted you to at least let's look at the front page before we go off of this. And you can see, no thanks, I don't think I'll do a survey. You can see that up to the front of the page on the right, they have what is NDEP promoting. And every month they have certain things that they're promoting. For example, this month I think has to do with health literacy. Next month is diabetes, National Diabetes Month. So if you click on there, you can see those items and look at a lot of materials related to that. Then down towards the page, they have sections that are for people who actually have diabetes. for people who are at risk, and for health professionals, businesses, and schools. And then they also have a place for partners and community organizations. So those are interesting places to go. Also, clear at the bottom on the right-hand side, the Diabetes at Work. That one actually has lesson plans and handouts to go with those lesson plans. Some of them are the NDEP that you would find in here. Other ones are from other organizations. And there's some very nice handouts in there, so that may be a place that you'll want to look to find some additional handouts for using with your diabetes classes. Okay, I think we'll just shift over to actually the rest of what I'm going to say as far as I'm going to do the first item in the snippets section on your agenda. And if you look under that tab in your notebook, you should find that there is some information that talks about reporting of DSME comprehensive classes. How many of you have had the Catalyst training? Oh, good. Well, we won't have to extend our agenda another 3 hours today to cover that. Really, what I'm going to mention today, I'm glad that many of you have had that, but what I just want to mention today is very briefly some of what you need to keep in mind in keeping track of data about the class series that you're doing, and this is particularly for the comprehensive classes. I believe Teresa mentioned earlier that you need to be sure to, have a sign-in sheet and put on that sign-in sheet the information that you're going to need to keep track of when you report in Catalyst. At this time, for fiscal year 15, the one that we're currently in, we're just asking for you to report some process information. It would be ideal to be doing some follow-up information with the people that come into the class, and those of you like Julie and let's see, at Cumberland, Lake Cumberland District Health Department, who have the recognition programs, you do have to keep some outcome kind of data about what's going on with your participants. And we may be doing that in the future, so just keep that in mind. But for this fiscal year, we're just asking you to kind of report numbers and the kinds of things that you've done as far as that goes. So you'll need to know the month that you complete the series of classes. And as has been mentioned so far today, those classes can be provided, in a variety of ways. Michelle talked about 8 hours all at once. It could be 4 2-hour classes, 3 3-hour classes, any combination that you want to do, but keep track of how you did that and the number of hours that it totals up for the class series. We say that it needs to be 8 hours to cover the information adequately. And so some people end up doing it a little more than 8 hours, so we'd like to know what those hours are. Those are, I'm not going to go through the details of where you put everything in Catalyst. That's the Catalyst training, but I did make copies of the slides so that you could just refer to that when it comes time to want to do that. It's also would be in your Catalyst training information. But anyway, I put in parentheses here as I'm talking about the number of classes where it would actually go on the Catalyst screen. But you'll also want to be able to, keep track of a little description of what your class series was like, so you can put that in the output journal in Catalyst. And you'll also want to keep track of the attendance. Now in Catalyst, we use kind of we've selected some audience types that we like to track, and you can see them listed on here. There are 6 different categories, and those are not specific just to diabetes self-management education, but they're used in a lot of different activities in the Catalyst system. They are, they're not uniquely, they're not mutually exclusive, because someone could be African American and senior at the same time. So the important thing is that we like to track those African American and Hispanics are kind of our high risk populations that we want to make sure we account for those if they come to your classes. So they take precedence. If someone is an African American senior, you count them as an African American in that count number. If you're going to the Senior Citizen Center and almost, they're basically seniors, you count them in the senior category. But if you had 5 African Americans at the Senior Citizen Center, you put them up in, up in the, of course, DSME is not targeting youth particularly. Our program basically targets adults, but we have that in there because in some of the other interventions that you might be recording in Catalyst, we need that audience field. So that's there. And oftentimes you'll just put people as multiple populations. If you just have kind of a, you don't delve deeply into a person's ethnic and racial background, but just the obvious estimations of what you have in your class. So that's how we like to keep track of that. In the past, we have asked for self-management goals to be recorded. This current year, we are not going to be asking for you to give us those kind of numbers, although it is important to still work with your class members to help them with setting self-management goals. And one thing in Catalyst that I'll just mention here is that for most things that you enter into Catalyst, most individual events that take place that might be in an activity type, like in Catalyst they talk about activity types, and that is like diabetes self-management education, that's an activity type. A diabetes self-management class held at the Senior Citizens on August 2nd, 2014, that's an event. But it would be, if it's comprehensive classes, the entire series is considered one event. I didn't explain that real well, but it's one of the few things, it and the diabetes prevention program, we consider a series of class as one event. So you'll learn about that in the Catalyst training if you haven't been there. We'll be reinforcing that with you, but that's something just to keep in mind when you do this. So when you go back and start doing some of these things, take a look at number 1 is ongoing throughout the year. As you provide a series of classes, we would encourage you to put, when the series is finished, to put it into Catalyst and record the number of people that came. There's one other thing that we want you to keep track of as far as the people go, and that is the unduplicated count of people, the unique people. There might be someone that comes to all 4 classes in a class series, one person that comes all 4 times. When you count the attendance, you would count them 4 different times because you're reporting the attendance at the class. At the end of the year, we would like you to report for the entire year the number of unique individuals who attended any portion of a comprehensive diabetes self-management class. And that is the very last item in the first set of bullets. It explains that a little bit. And that is number 2 on page 3. It talks about annually at the end of the year, report the number of unique individuals who have attended any part of the comprehensive series. I'm not sure I explained that as well as I should have. Does that make sense? It's a little, so when you're keeping track of your classes, you need to keep that in mind as you do your sign-in sheets and as you summarize what happened throughout the year, that kind of thing.
It's helpful sometimes, like if you do a sign-in sheet, and I'll just use this for an example, if you are doing 4 2-hour classes, that you have the sign-in sheet with their name and address and all their demographics, and then on the end you have class 1, class 2, class 3, class 4. And then you can just check, they were at class 1, 2, 3. But it also then is easy, like at the end of the year, to look at just people that came, individuals. You know, you're not just gonna take, like if your first class adds up to 20 people came, the next class, 19 people came, 17 people came, and then 20 came. You're not just gonna add those as a total for those individuals, because you're trying to count how many people did you impact. But if you keep your sign-in sheet that way, it's easy to then just look at people, numbers of people. Whether or not they came to 1 or all 4 is what that end of the year number Rita's talking about. So to me, it's helpful if your sign-in sheet does that work kind of for you.
And I know I was asking or looking on the curriculum disc because I know several years ago we had examples of sign-in sheets, but I don't believe they're on there anymore. If it would be helpful for you all for us to have kind of a template of a sign-in sheet, we can work on that, or we can query some of the people that have been around for a while and send out examples of what they might, ask them to share some of those, if that would be helpful for you all.
Okay, thank you. Okay, I'll go right on into, we just wanted to make sure that you had a little bit of information because we've had some questions about the Kentucky Diabetes Educator License in 2011, and guess what? We were the only state in the whole United States that had a diabetes educator licensure law. Since that time, Indiana passed a law, a licensure law, in 2014. So we have been sort of, I don't know what to call it, but sort of guinea pigs in how to figure this out and maybe exactly what this should look like. So it doesn't mean that what we have as our law may not be perfect, but I'll tell you some of the reasons why it was passed, and it is being looked at to try to have more states actually develop a similar type law. So just to give you a little background, the intent of that diabetes educator licensure law, and just as background, when Kentucky passed that law in 2011, the president of the American Association of Diabetes Educators, of AADE, was from Kentucky. So that may give you an inkling as to why and how, you know, that happened in Kentucky. And it was Debbie Philman. Some of you all may know Debbie, and she's actually our district director now at Green River District Health Department. But at that time, she was the president of AADE when our law, or around that time, when that law was passed here in Kentucky. And this is according to AADE. What was the original intent? Why would we need that kind of law? Somewhat for recognition of qualified diabetes educators, because you may have had, and it did have, people out there calling themselves a diabetes educator that maybe didn't have the background and potentially credentials to even be calling themselves a diabetes educator, to also provide like minimum standards for that recognition of the professional, and to give them a scope of practice, and to also for some consumer protection, so that anybody selling anything couldn't call themselves a diabetes educator just or using those terms. But I think the real bottom line reason for a licensure law is they were looking at trying to be able to do future billing based on an individual's credentials, and therefore you would need licensure to help set that scope of practice. So it really probably boils down to a billing and payment for an individual to be able to bill and receive payment for diabetes services. Right now, for example, diabetes self-management education can be reimbursed. You've got to meet standards and be an accredited or recognized program, but it's not the individual that might be providing that service that can get that reimbursement. Does that make sense? Yet, I think the feeling was that if we could get licensure, that we're actually credentialing the or licensing the individual as a diabetes educator, it could help lead us along those lines to be able to get billing and payment for the actual provider or diabetes educator. Now, AADE, that National American Association of Diabetes Educators, says that diabetes educator licensure is intended for a healthcare professional that has a defined role as a diabetes educator, and not just for those people who might be providing some diabetes education. Does that make sense? You know, because all of us as nurses and dietitians, we all are physicians, and as being healthcare professionals, you all provide some diabetes, or we all provide some diabetes education at some point or another. But this law was meant to, and licensure was meant to, be someone who really focused, and that was their job is basically as a diabetes educator, and that's basically what they did in their routine job, day in and day out. Okay, so AADE's recommendations were that they defined certain disciplines that would be eligible to become a licensed diabetes educator. They also defined certain education levels before you could be called a diabetes educator, and they also defined what they would recommend as professional practice experience. So that is what AADE recommends. However, AADE does not have power over licensing boards or in Kentucky, our Legislative Research Commission and our legislators that have write the law and put the law into effect. They just have recommendations. And so, and I'll just give you one example when I said that we're sort of the guinea pig. When our law was first passed, it used a very generic term of just health professional. It did not define who, you know, like AADE's recommendations, could become a licensed diabetes educator. That it was said back when the original law was passed would be defined in regulations. However, then when regulations went to be written, they were saying, no, that should have been defined in your statute. Not, you know, so that's what I mean about where there may be some changes as we go along to our original law that help better define some of the questions that have been coming up as far as who can be this and that sort of thing. I will say that our board, that is the Licensure Board, is made up of an RN, RD, a registered pharmacist, an MD, and then one public representative, and one of those has to be a certified diabetes educator, and that board has tried to work within the parameters that they've been given to help define some of those definitions that maybe weren't in our original statute, and they've come up with some different categories of licensure and some of that sort of thing that we'll go over just briefly. But the Kentucky statute that deals with licensure as diabetes educators in Kentucky is KRS 309.325 to 309.339. That's the actual KRS law. And if you go to this website, so it should be in your handouts, you can view that, read the statute, and read regulations that may go along with that. I will say too that there is a web address for the Kentucky Board of Licensed Diabetes Educators. They were put under the Public Protection Cabinet, and their web address is just bde.ky.gov. And they just recently had, and I think you have that in your handouts, frequently asked questions document. And this really all just actually got into place within the last year. Even though the law was passed in 2011, it was probably in the spring of 2014 that we were able to become licensed as a diabetes educator in Kentucky. And so you can go to their website, and this, where you can keep up with as they update. This is just a close-up of their website where they have the area for the frequently asked questions that they usually update about every 2 to 3 months. So, okay, their frequent question number 1 says, I'm a physician nurse who provides diabetes education as part of my job. Am I required to get a license in order to continue providing diabetes education? Okay, it says if you are a licensed professional who provides diabetes education as part of your practice, etc., you are not required to obtain a license from the Licensure Board. So is that's their frequently asked question number 1. However, it says you cannot use the title Licensed Diabetes Educator or a similar title like Diabetes Educator. Does that make sense? Okay, their question number 2 says, if my professional license does not require me to become licensed, then why would I want to? And it basically goes through and explains it's not a requirement, but it's still important for people currently practicing as diabetes educators to become licensed, because professional licensure has numerous benefits, which it lists, and without the legal definition tied with licensure, diabetes educators will continue to be self-defined. But it also says that those wanting to serve as supervisors of other diabetes educators or for an apprentice diabetes educator license, they're required to have an active license as a licensed diabetes educator in Kentucky. So if you want to supervise or serve as an apprentice, you must have the LDE is the abbreviation that they're using. Licensed diabetes educator. Okay, what's an apprentice diabetes educator? It's like who should apply for this apprentice? This is some of the language that our licensure board has begun to add to our regulations that were written about the statute. And so it's saying having the apprentice diabetes educator permits required to pursue a diabetes educator license to legally practice diabetes education while you're gaining work experience required for licensure as a diabetes educator. So, does that make sense? And then it also defines what is a licensed diabetes educator. It's a healthcare professional with a defined role as a diabetes educator. The LDE provides comprehensive diabetes education within the scope and practice as defined by statutes and regulations set forth in that KRS that we talked about. The license, it says, is the minimum requirement to practice as a diabetes educator in the Commonwealth of Kentucky. And an LDE may or may not be credentialed as a CDE or with certified diabetes educator or a board certified advanced practice management educator. And those are two categories of where you can actually take a test that they're a credential. In other words, the CDE is through the National Certification Board for Diabetes Educator, but they're not a license. You know, it's like you have to have a nursing license in Kentucky to practice nursing. You have to have a, well, licensure as a nutritionist or dietitian to practice in Kentucky. And so this is different than a certification, like the certification exam. And then there's also something called Master Licensed Diabetes Educator, and those would be people, according to the regulations that our board has written, that already like have your CDE, you're showing a higher level of, because you've passed a national examination, a higher level of functioning. So it's sort of like your LDE would be a beginning level, and that's licensure in our state, but then you could go on to become a CDE, Certified Diabetes Educator, or a BC, is it ADM, which is through AADE. So you could build on that license, and then you would be using also, in addition to that, MLDE if you are from Kentucky. That's the way our board has begun defining things. So just to point out a couple of things that have been added to that Licensure Board's website, they have, like under resources at the very top of the bar, you can like look at resources and you can get the laws and regulations that pertain to this. You can also get applications and forms. So if you want to apply to become an apprentice diabetes educator, you can do that on the website. You can download the form and do that. And they also recently added license verification, just like I know we have that in nursing. I'm not sure about dietitians, that you can get online and verify who has a license or not. And then also license renewal for LDEs only can be done, I think, online. The MLDEs have to do it the old-fashioned way, hard copy, paper and pencil. But if you have questions about licensure, you know, there's the statute, the regulations, but most of the time you're going to have to contact the board and they will answer your questions. And this Jennifer Hutcherson is their administrative staff and will get the questions to the board. They meet usually monthly or every other month, so that if you have questions specific to you in your case, they will, you know, address that and get an answer back to you. So that's Jennifer's email address. Are there any questions? Things are being worked out and maybe continue to be changed. In fact, I think they just recently made some regulation changes in the last couple of months. So like I said, I think things are still being worked out, and Indiana is probably maybe doing theirs a little bit different. They may be following more exactly what, you know, AADE sort of had outlined, and now we're getting there, I hope.
Thanks, Janice. Okay, so I'm the last person standing between you and the door. That's never a place you want to be at this hour of the day, so I will be brief. I want to tell you just a couple more words about that last bullet, which is recognition, accreditation, and reimbursement. I did put the national standards in there, as I mentioned earlier, for diabetes education. And if you're thinking about wanting to be an accredited or licensed program, you'll want to get real familiar with those standards, because those are the things that you'll have to do in order to do that. It may be a little bit too much for you to absorb right now, but just know that they're there. And if you are thinking about accreditation at your health department, let us know. We can help you, offer you some resources with that. But we just want you to be aware of that. That does really get us quality standards. It gets us a very defined evidence-based platform for our work. So we really do want people to pursue that if they can, but we certainly understand that's a little too much to swallow right now, so just know that it's there. If you'd like to read a little bit more about that, you can go to either the American Association of Diabetes Educators or the American Diabetes Association. They both license and recognize or accredit programs. So either of those websites will give you all the information you want to know. Just know that it's almost a year-long process, I think, before you can apply. You have to collect data. There is a fee. And again, those standards will tell you about all the things that you have to kind of have in order. It's not a real simple process. It takes some work to do, but it's worth it. We've got some folks, like I said, that have some precedent there, and we can help you with that. But just let us know if you're considering that. Let us know, because one will want to help you a little bit, but we also want to know that. We're really interested in who is it that's thinking about this, so that we can kind of get an idea of who might be considering that in the state. I know a lot of folks are interested in reimbursement. I know that's a really hot topic for everybody. And I'll tell you a few things. Janice mentioned a couple, but the best thing I'm going to be able to say to you is stay tuned, which is probably not what you want to hear. But basically, Medicare and Medicaid both reimburse for diabetes self-management education. Medicare requires that you have to be one of those recognized programs in order to be eligible for reimbursement. And as Janice said, that's the institution that's getting reimbursed. So it's the health department or the hospital or whoever you're billing under their provider number. Individuals, like I'm a CDE, but I won't get reimbursed for providing diabetes education because I am not a provider under Medicare or Medicaid. I don't have an ID number for that. So unless you're an ARNP or a doctor or somebody that can get recognized as a provider, this is the only way you get reimbursed. That's kind of what Janice was talking about, where licensure might help us kind of line up for that a little bit better, where you actually have a license that allows you to provide that service. Sometimes that can help line up reimbursement situations. Medicaid, traditionally in the outside world, Medicaid pays for outpatient hospital programs, particularly. That tends to be where they focus. But they also have reimbursed somewhat for health departments as well under the preventive package that you all might be familiar with in your health department that says, you know, Medicaid's going to bill public health for all this package of services. Diabetes is actually in there, has been in there. However, when we went to the whole managed care thing, that got a little muddy. It was a little muddy before, and it's even more muddy now. So we're trying to sort of work that out, but it seems like some people have approached those managed cares directly and are talking with them. We're trying to have some conversations here, and I did actually talk to Dr. White this week because I'm having some struggles just trying to get to the person who can answer these questions for me, because if you ask 3 people, you'll get 3 answers, I promise you. We're trying to nail this down as best we can, because we know that reimbursement is important to people, and we want you to get reimbursed for your work. But we're going to have to figure out how that works on the Medicaid side of the house. But we will get that nailed down. But if anybody has been having conversations with managed care organizations or having any discussions or success there, please let us know. We'd like to be aware of that. And we also have some, our folks at Lake Cumberland who have achieved recognition. We have asked them to help us with developing a model for this, so that if other people want to do it, they can have something that's a little more user-friendly and pick up and go with if you want to do it, and that's something that makes sense to a health department kind of situation. So they are working on that, and reimbursement is part of that. They're trying to also look into how would that work, and how would you bill and code for that, and work with CP, and blah, 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 blah. So all of those kinds of details. So we're going to have something for you, I hope, soon, but it's kind of muddy right now. If anybody has anything else they want to share with me about their conversations, I would be glad to hear that. Private insurance is all different. They ask different things, require different things, reimburse for different things. It's not really a standard process, so that's sort of all over the map depending on who you're talking to. So we're going to try to nail that down for sure for Medicaid, and see what we can do going forward for some of the others. So stay tuned. We will have more information about that. Any questions about